Hi everyone, it's Wonderful Wednesday and also Words of Wisdom. Today we have depicted on April 15th because tomorrow, April 16th, is National Healthcare Decision Day. And it's a day for patients to make known to their health professionals the kind of care they wish to receive and have those wishes respected and met. So April 16th every year is what they call National Healthcare Decisions Day. And give a little bit of history. And the reason why this is celebrated is that we need to be aware that there are times that you might need to make some decisions about your healthcare, but to anticipate and how to make them. This day is set aside to help you take care of those potential situations ahead of time, and it is a day for patients of health or healthcare receivers to make known to healthcare professionals the kind of adequate care they wish to receive and those their wishes respected are met. Now, especially a lot of you online that I've been working with and that are viewing audience, keep in mind that you as a caregiver or the power of attorney or healthcare surrogate for your senior loved one is the responsibility is to make this known to their healthcare professionals for you to carry out these details just the same. When you were elected to be your power of attorney or that of a healthcare surrogate, it comes with the responsibility of guiding your loved one when they are in that inability to do so. There's a lot of things, there's advanced directives. What would you like for your last wishes? Where you would like to go, where, the hospice realm, maybe changing a provider to come to the home versus going out. There is so much involved in it. And also when your loved one goes to a hospital situation, when they can't speak for themselves, and even a rehab center or rehab hospital, it is best that you are involved so you can speak on their behalf as well. So this day is so important, but it's all important all year long as well when you're dealing as the caregiver for your senior loved one. So we're going to talk about how to observe this healthcare decision day. Is one, plan ahead for your important healthcare decisions, not only for yourself, but for your senior loved ones. And keep this in mind. Would you want the burden to be left on your family members in case you become incapacitated? Maybe you were a car accident that you're not able to make your decisions known. So having all these decisions beforehand really reduces the burden on your children, your family, to help them along with what you would want. So really, it's being proactive, no matter how old or young you are, is to make these decisions and have it in concrete, a documentation. That is usually given to the doctor itself that is on your care. And also, if they go into the hospital, that's part of it as well. It's also, they even say even have it in your glove box of your car or your truck or whatever that may be, because you might not be able to speak for yourself and no contact is available for the EMS or the fire department or, the first responders to treat. Okay, so very important to have this done. Find the documents you need now, complete them, and put them where they are easily accessible. I agree. So what it is, these documents, you need to go to an attorney to get this done. It may be an elderly attorney, family law. Ask them if they do the advanced directives. And then complete that with the attorney, but then more importantly is make it accessible. Not only like what I just mentioned, but every family member that you depicted to be the POA or healthcare surrogate or next to kin, let them have a copy of it as well too, so they have it in hand. Discuss your decisions with your loved ones. I think if you talk about it now, the same thing with your senior loved one having that conversation with you, it is easy for them to process. They have all the concrete information that they need, not only verbally from yourself, but more importantly is that it is now a legal document as well too. So it makes their help along the way in decision making very much less burdensome. Let them know where your documents are in the event you have a healthcare event. Like I said, I think everyone should have a copy of it. But more importantly than anything, keep one safe at home. Glove box, doctors, everything is on file. So there is no doubt. Encourage other family members to complete advance directives too. Let this be something as a gift that you give your children, your loved ones, that they should plan accordingly for their future. Again, one never knows what we could be struck with. Not only an illness, but a car accident that could be very devastating, and you're not able to make your own decisions. Don't place the burden on these decisions on your loved ones. Just as I mentioned, it does less the overwhelming burden, but more importantly, it is a relief knowing that they're carrying out your wishes as well. So don't place the burden with these decisions on your loved ones, but I want you to also think of it as you being the POA for your senior loved ones. That is something that's really important, that guess what? I'm doing exactly what my mother and father asked of me to do. So it really, like I said, is a gift. If they're in senior living, they require this information just the same. There's like such things as DNR, which is do not resuscitate, that or required documents in a hospital, skilled nursing, a senior living, but all at all times when it needs to be done. Where can I get an advance directive? Is a question, frequently asked questions. Healthcare provider, an attorney or a state bar association, health department, care facility for the aging. I'm going to say number one is an attorney. They have all the legal documentation, which it could be now stamped that it was notarized with witnesses as well. But this is something they do on a regular basis. So the verbiage is very common to them. So that's really where you would want that to be done. Is do not resuscitate or a DNR the same as advance directive? No, but a DNR, it can be part of the advance directives. DNR stands for do not resuscitate. That means any means of bringing you back to life. You're pushing that away. That is something that you as for your body to make that decisions as well. Why is National Healthcare Day so important? It helps us stay positive. By making important healthcare decisions ahead of time, being proactive, this day helps us to stay on top of health situations. It values cannot be overemphasized. It's very, very important. 2, it saves us from bad decisions. When we apply the advice received from professionals on this day, we are able to avoid costly errors, result in poor decisions, and this will in turn to lead to healthier choices. 3, it helps us get the best of treatments. With decisions about possible future challenges being already made, patients will get the most suitable treatment in case of an eventual occurrence. This will obviously improve their chances of healing and quick recovery. So how do we start this process when you're with your senior loved ones? Have a conversation. Mom, Dad, I want to be able to carry out your wishes. We were advised by an advocate and by others, by an example of other family members are going through it just the same. Maybe we should talk to an attorney so we could follow out your wishes as exactly the way you want them carried out. And it's a legal document that we all have to follow. I think it's a sensitive subject. Yes, it is, but it is necessary because later on, it really, if it's not done, it becomes very much a problem as well too. Amongst family members, the siblings, everybody wants to add in, but they're going against maybe what their real wishes are. But if it's not documented, it's a hard thing to occur. As always, I lead you to my website. It's www.goldenruleseniorplacement.com, and there you will find not only my demographics, you will also find my bio, the different testimonials from different of our clients and professionals in the area, and also there will be various options on senior living, and then also resources. And there's a whole library of these video talks, may it be now Tuesday talks that we've been doing for the last 8 years, and we just started this year in our 8th year of business, is that we're starting WOW, which is Wonderful O Wednesday and Words of Wisdom. So to no further ado, next week on WOW, we're going to be talking about, which is April 22nd. Since this is Parkinson Awareness Month, we're going to talk about that in context that what can you do to support your senior loved one. And then next Tuesday talks, which is April 21st, is Parkinson's Awareness Month. What should you know about Parkinson's disease, and what assistance can you get for your senior loved one? So we're accomplishing this on Tuesday Talks as well as Words of Wisdom, because it is a diagnosis that needs that much attention. Thank you, as always, for viewing WOW and being part of our Golden Rule family. We wish you a blessed week, and we'll see you next week. Take care. Bye-bye now.